Welcome to Your Health Today. I'm Kristy Money from the Caldwell County Health Department, Health Education Department. I have with me today Cynthia Jolly, public health nurse, who is our Women's Health Nursing Director. Welcome, Cindy. We appreciate you being here. Tell me about your experience at the health department. You've been there for a while.
Okay, yes, I've been with Caldwell County Health Department now about 28 years. And I have really enjoyed my years with the health department. I have learned a lot and met a lot of good people and had a lot of good experiences with patients, and just really enjoy what I do. When I came to the health department many years ago, back in 1996, I started out in home health and worked in home health for about 2 years. And I transferred after that point in time over to the maternity clinic, and at that time Cindy Yance was over that, and it was called, the pregnancy care manager program was called Baby Love. And a lot of people in this community, if you ask around, they still remember Baby Love. They remember getting what's called baby bucks and working towards getting some type of gift at the end of their pregnancy. And it was just a very rewarding program. I know all the nurses, we enjoyed doing that. And I worked in that program probably about 4 years, and then went on over to the clinic. Wanted some experience in clinic too, so I really broadened out in public health. I wound up getting experience not only in maternity and home health, but communicable disease, STDs and treatments, family planning, women's health in general, that includes programs like BCEP and Wise Women. Back then we still had that program, immunizations, so adult health physicals, things like that. So I mean, I have a broad spectrum of experience in public health, and I can't say that there's anything that I didn't enjoy doing, but my love in public health is definitely maternity. So my heart was always there, and I wound up returning. And now I've been with maternal health again since, I believe it was around 2011 when I transferred over. So the years just keep ticking by so fast, you know, time flies. But I've been over there for several years now, and just really excited about our program, excited about what we're doing for patients, and how we're still working in our community to try to help people get the prenatal care they need, and to meet their needs. You know, the hospital, Caldwell, no longer delivers, so you know, we've had some challenges there, but we're working with those challenges. We're still going strong, and we're still seeing patients, and we want to continue to do that.
That's great. We're so fortunate to have you in our women's health clinic with all your experience, and of course we have some awesome providers there. We have a board certified OBGYN, Dr. Picton, and our other providers, Christy Ruff and Roger Keever, which they're amazing.
Right.
So can you tell me about the prenatal clinic, and what are some of the services that we offer there at the health department? Okay,
so our prenatal clinic is based a lot like what you would see out in a private care spectrum at any of the OB offices. We generally start by bringing the patient in to do the pregnancy testing. And from there, if it's positive, we talk with them about prenatal care. We offer them vitamins, and hopefully they'll take prenatal vitamins. We talk with them about what their needs are and what their expectancies are with prenatal care. We also do education around what trimester that they're in their prenatal care. And you know, just give them their options of what's out there and what they can do. So generally they'll decide to go ahead and come in and see us for prenatal care to start with, and we do explain to them from the beginning that we don't deliver. So we'll generally now see our patients from the very beginning up to about 28 weeks before transfer. unless there's an issue going on in their care, because every patient's different. Every every pregnancy is different. So there could be a really high-risk pregnancy that have more needs than it should be done at our health department. So if it's, someone per se, like they might be in renal failure or something like that, then we talk to Dr. Picton, and he gives us guidance on what is best for that patient. Right. And we go from there. But generally they'll come in and they'll get their history, and the history is inclusive of not only the patient's medical history, but we're also looking at their family history, which would include their mom and dad and the grandparents and their brothers and sisters, and also the father of the baby and his family. So we look at their genetics, we look at the actual patient's history of what's going on with her, whether she has any chronic conditions or not. Certain hereditary conditions that could be there, we ask about the rest of the family as well, and that's included on the genetics too. And of course we do an immunization history, a vaccine history. We do a communicable disease history, for instance, hepatitis A, hepatitis B, hepatitis C, all those things. We want to know if they've been exposed, or if they've had the disease in the past, or even if there's a possibility of active disease. And of course, in the history, labs are included. And in those labs, it's a broad spectrum of things. One thing is their blood type in screening. We also do hepatitis A, hepatitis B, and hepatitis C testing. We do HIV and syphilis testing. We do a hemoglobin. We'll do a lead if it's needed. And we have a questionnaire that tells us whether a lead is needed. There has to be risk factors to do a lead test, right, according to the state, what the state recommends. And sickle cell, if that's indicated, things like that. Right. So, and then as they get on into their pregnancy, there's other lab work done later on as well. One thing is testing through a company called Natera, which is testing, it's a full genetics panel. Well, not a full panel, but it's 14 different genetics diseases that's included, the ones that are most common that you would be concerned about in pregnancy. And we do also do what's called panorama testing, which is testing for things like trisomy, monosomy, things like that. They can also, through that testing, find out the gender of their baby if they would like to do that.
Nice.
That's wonderful, yes. A lot of people want to do that because they want to have gender reveals.
Yes.
And they don't really want to wait till their 20-week ultrasound to know that. They want to know, like, okay, I want to know that right now.
Yes.
So, and I understand that. I mean, that's a very exciting time for families, and everybody enjoys, finding out the sex. It's just a really exciting moment for a lot of people.
Definitely.
But a lot of times what they'll want to do, they'll be like, well, let's get a gender envelope and put it, so I don't know what it is. So we have to be really careful not to say, oh, it's a boy, or oh, it's a girl. We have to make sure we don't mention that. Because that's giving it away.
Right, that's hard.
And so after they get their history, they'll come back and they'll do their physical with either Dr. Picton or Roger Keever or Kristy Ruff, just depending on, there's not a certain person that has to do it. They can request, or we can just put them with the person that's available, unless it would be a very high-risk patient or a higher risk patient that we feel like Dr. Picton probably needs to see. Right. Just varying on that. But once they get their physical, then from there it's continual prenatal care. They come back in the first of their pregnancy about every 4 weeks. As they get further along, after their 24 weeks, it goes up to every 3 weeks. By the time they're 28 weeks, you're wanting to bring them back every 2 weeks. But at that point, we need to do a referral to be out to care, since we don't deliver. Right. There's times, though, things happen, like with anything. And if patients come in late to care, things like that, that's not ideal, but it does happen. And when it does, we're going to work with those people, and sometimes we'll have them a little bit longer.
Right. That's great. Mm-hmm. So Cindy, can anybody make an appointment? Do they have to have insurance, Medicaid? What's our requirements for that? And when's the best time to start that prenatal care and to schedule that first appointment?
Okay, so anyone can make an appointment that thinks they're pregnant. If you miss a period and you believe you're pregnant, or if you've done a test at home that's positive, and usually if you've gone at least a week to 2 weeks and not had a period, you should call and let us know so we can get you in for a pregnancy test. As far as beginning prenatal care, we want you to begin as soon as possible.
Definitely.
I mean, the sooner the better.
Yes.
Don't have a timeline on when, but we want you in there as soon as you can come in there. As far as, what was your other question?
Medicaid, insurance.
Medicaid and insurance.
Do we take anybody? What about uninsured even?
We do. We serve underinsured, uninsured. We serve people who have insurance as well. There is a process if you come in for your pregnancy test and you do not have insurance. What we will do that day is talk with you about applying for Medicaid through DSS. We have a temporary Medicaid application, which we can do as well. The temporary Medicaid application only lasts, after we've completed it, it's from the time you apply till the end of the next month. So it's 2 months or less.
Right.
And that does give you time to go to social services, start an application, go ahead and get that process going, and hopefully by the time that PE, that temporary Medicaid runs out, your Medicaid will have kicked in. That would be our hope.
Yes.
Now there are cases where people come in and have no documentation. By that I mean they're not going to qualify for Medicaid.
Right.
Because they don't have the documents to qualify for Medicaid.
Right.
And when that happens, they'll have the temporary Medicaid because we don't question those things.
Right.
So they'll have the temporary Medicaid up to 2 months, like we talked about. And then when their baby's born, they'll be instructed, or before their baby's born, really, they should be instructed by their prenatal provider, whoever that would be, to go around 37 weeks, 36 to 37 weeks to apply for emergency Medicaid. And emergency Medicaid does cover a delivery.
That's good.
So that's great. And then, of course, the baby should be able to go on Medicaid at that point.
Right.
As far as underinsured, yes. I mean, if it's underinsured situation, we can still talk with them about applying for Medicaid if they qualify, and we can bill insurance. And if it doesn't pay, it can always fall back to the Medicaid. Also, if they do qualify for Medicaid, also we have a sliding scale fee system at the health department, and that does apply to our prenatal patients as well.
That's good.
So, and we work with patients. We understand there's sometimes there's circumstances, there's things where people, they need that help and they need that assistance.
Yes.
And we're going to do what we can to work with those clients to make sure they get that prenatal care that they need, because that is very important. You just can't put a dollar on a healthy baby.
Right. True.
You absolutely cannot do that. I mean, we've got to do, in our communities, we've got to do what we can to have these patients come in and get cared for. This is our future.
Right.
These children are our future.
Yes, definitely. So, do we do ultrasounds at the health department?
Yes, we do. We have a lady that comes in on Tuesday mornings. She is currently coming in at 9 o'clock, and she stays till about 1, and that's on Tuesdays. And of course that is for our prenatal clients. Now, one thing I will stress, because we do get this a lot times, a patient will call, and instead of a pregnancy test, they want an ultrasound. And the thing is, at the health department, we have to have an order for an ultrasound from the doctor, and they have to have been seen by the doctor in order to have that. So a patient coming in for a pregnancy test, by that, when we have that appointment, that means you're coming in to get a urine pregnancy test. It won't be blood work, it'll be a urine pregnancy test, and we won't do an ultrasound without an order from the doctor.
Right.
But, you will get an ultrasound once you start your care. That's one thing, you will. And usually what happens on that is the patient will see the nurse first for the history. They'll come back the next visit to see the doctor for the exam. And when the doctor does the exam, a lot of times it's up to them. It's their discretion now. But if they feel that it's necessary, they'll do an ultrasound for dates and confirmation, things like that.
Right.
So, and that will be done the following Tuesday or whenever there's an appointment available.
That's great.
Mm-hmm.
So,
and she does do some GYN ultrasounds, but still, again, that's up to the doctor's discretion to order that.
and we have a great person that does ultrasounds too,
Yeah.
which is awesome.
She's lovely. She's wonderful.
Yes.
And she's a lady that enjoys what she does, I can tell.
Yes, definitely.
She really does. She has a business in Granite Falls called Miracles Happens. And down there she does the 3D ultrasounds. So if you're interested in that in any way, you can give Lisa a call at Miracle Happens down in Granite Falls about those private ultrasounds that she does.
And Lisa's been doing it for a long time, so she's got a lot of experience, and she's amazing at it.
She's about like us, Kristy.
Yes, I've been doing it a while.
She's got a number of years. Yes. She really does.
Yes. Okay, so we talked about we do have the ability to provide all the labs that are needed.
Right. And we do.
Which is great.
We do all the labs that are needed. It would be very rare. Now, there's a few things that would not be able to get done at the health department, one being a 24-hour urine. We don't do those at the health department, and if Dr. Picton has a concern about preeclampsia, a lot of times he'll order a 24-hour urine, so they will have to go to the hospital and pick up their urine jug and turn it back in.
Right.
So just, so you know that, but for the most part, all of our routine labs are done at the health department. Now, having said that, they are sent out through private labs, some of them. Currently, LabCorp is our lab that we use, and Natera is our lab that we use for our genetics and our birth defect test, and the one I was telling you about that includes the trisomy and the monosomy birth defects. Those go out to Natera. Now, well, we won't get into billing. It's too complicated, but the patient will be talked to when they come in about bills related to labs and things like that.
Right, and we have an amazing lab staff also at the health department.
Oh,
so
absolutely.
They've got
Absolutely.
experience too in doing labs, and they do a great job. So do we provide delivery services for patients?
Well, we don't, because we don't have anyone that's staffed at the hospital or has hospital privileges to do that. And of course, Caldwell is no longer delivering, so most of our patients decide, and it's their decision. We tell them that up front. Most of them decide to either deliver at Catawba, Grace, or Fry. Occasionally, we'll have some that go to Watauga or down to Statesville, but most of our clients stay up this way. Now, we do have some that's extremely high risk that have to go to Forsyth to deliver, because they're too high risk to deliver in either of those other hospitals. But yeah, that's the answer to that.
It's great that we have the neighboring hospitals that are willing to work with us, and that we can refer our patients to them, and they're willing to provide that service for them. Tell us about your pregnancy care managers and what they do to serve clients.
Okay, we have on staff right now, we have 2 RNs that do part-time pregnancy care management, Francine Jimenez and Rhonda Ledford, and then we have 2 full-time social workers that provide care management, and that's Regina Heffner and Emily Gokenauer. I'll tell you, I'm very proud of all of those girls and the hard work that they do. I mean, they just work tirelessly with patients, and they help wherever they can. care managers, they sometimes are kind of hidden in the background, but they do so much. They're a liaison with you and your prenatal care provider a lot of times. They're also an advocate for you as a patient. They're a resource. They have endless resources.
Yes.
They're very, very knowledgeable, so they can provide a lot of education. They can just be someone who just listens when you have a need, and you just want somebody to say, "Okay, I hear you. I'm listening." And there are times like that. I mean, there's times in your life that you just feel like you don't know where to turn. And you can call one of them up and they'll talk to you and listen to you. And if there's a need that you want help with, they'll do everything in their power to try to help you with it. Now, we can't solve everything, and we can't do that, but we can certainly be there for you and be an advocate for you, and try to provide you with resources on the needs that you have in your life.
Which is great. You've got an amazing staff, which is
awesome.
great. So tell us about your childbirth classes. I know that's always a fun time, the childbirth classes, and we've got one coming up pretty soon.
We do. The last Friday in April is our next childbirth class. Now, I don't have my calendar with me, so I can't tell you the exact date, but it is the last Friday in April. Our Childbirth Fun Day has evolved over time. We started many years ago, and Kristy, you'll probably remember this. We used to do our classes like 2 hours at a time, and we would do them weekly.
Yes.
But we found over time, people's lives, things are evolving, things are changing, and a lot of times, with jobs and other children and just things
Yes.
come up. They can't stop and come to a class every week. So we decided that we would combine it and do a Childbirth Fun Day. So our classes start at 10 on Friday and they end at 3 o'clock. We provide lunch during the class, and we also have some door prizes that we give out. We provide education based on a lot of things. One thing being the stages that you go through in labor and what's happening to your body as things are transitioning towards having the baby. We talk about how your pelvis has to open up and how the baby has to come down, and how your cervix has to dilate, and it's going all the way from just this little tiny hole to that, so that baby can come out. And that's amazing. I mean, it's just amazing what our bodies can do. But we have to have confidence going into labor, and we have to have belief and try to not have the fear there. And that's what we try to work on in class is, building confidence, giving tools so they know when they go to the hospital what's going to happen, what to expect. Don't be afraid because you go in a room and you got a tray full of tools laying here. This is what these tools are, and this is what's going to happen when you go in to labor, and this is what the nurse is going to do, and this is what you can expect. And we really, really encourage making tours to the hospital to meet your staff and to go around and see what kind of room you're going to be in, and who's going to be taking care of you, and can I get in a tub, can I not, questions like that. Can I have a birthing ball in my room, can I have a bar over my bed? Just all kinds of things that you might think of that come up. How many people can I have in my room? Well, those are the things that you need to go talk to your hospital that you're going to deliver, and also your doctor, because believe it or not, you really need a birth plan in place with you and your provider so that you're on board and you kind of know what to expect with that. Yes. And we also do in our class go on through the birth and talk about after you bring the baby home and some child care points with your baby, postpartum depressions, postpartum going on birth control, choosing a method, things like that. So we go into a whole gamut of things.
A lot of great information.
Lots.
Definitely.
Lots of information.
And a fun time.
It's a very fun time.
Yes.
A very fun time.
So, do we offer WIC services to our prenatal patients?
Yes, we definitely do. We start from the very beginning of finding out that positive pregnancy test, of encouraging our clients to go to WIC. WIC is an awesome program. They're like us. They have hours, maybe a little varied from ours though. We're there Monday through Friday, 8 to 5, and I believe theirs are a little bit varied. I think is it 7 to? I don't want to tell you the exact.
I know, me either.
I don't want to say the exact hours because I don't want to be wrong. But their number is 828-426-8407. If you would like to give them a call about their services, and they'll be glad to make you an appointment. WIC offers a lot of things. They have breastfeeding support services. They have nutrition counselors on board, and they have people who can talk with you about your pregnancy and about what to eat, what not to eat. All of those things that you might ask. Also, breastfeeding questions that you might have. There's a lot of questions around breastfeeding a lot of times about food and what you should and shouldn't eat, how much you should drink, all of those things. How much should my baby be wetting? How many poopy diapers should my baby have? All of those things. They can answer a whole gamut of things. So I definitely encourage you to do WIC. And remember, you get a WIC card, and you can take that to your grocery store, and you can get all kinds of food items during your pregnancy. Oh my goodness, it's so much. And plus they have a fruit and vegetable program now too. So, I mean, it's absolutely awesome. It's wonderful.
Some great nutritional food for the
Health of the baby.
Yes, definitely,
Yeah.
which is awesome. And then WIC services can continue after the baby's born, which is awesome too, up to age
Absolutely.
5. And that's another great staff. It's our WIC staff, and they're so willing to help patients and
Right.
help them deal with any type of problems they would have with feeding or breastfeeding.
Yeah,
They're great.
It is.
So I know that there's been some concern lately about syphilis in prenatal patients. Can you tell us more about syphilis during pregnancy, what's being done to prevent it, and how we can treat the syphilis in our patients that are pregnant?
Well, I will tell you that syphilis is on the increase, unfortunately. It's unbelievable in just the past 5 years how much change we've seen in syphilis. Between 2012 and 2022, there was a 547% increase reported in cases in women, and 5,600% increase in congenital syphilis. Already in 2023, we have experienced 5 congenital syphilis-related stillbirths and neonatal deaths. It's unreal. In our community, we had done a little bit of research for 2023, and we were able to find where we had seen, or there had been, I don't know if we necessarily saw all of these cases at our health department, but they were seen, and they were Caldwell County patients.
Right.
We've had about 3 pregnancies involving syphilis. Fortunately for us, they were all appropriately treated, and there was no congenital syphilis cases.
That's great.
As far to my knowledge, as of right now, there are no congenital syphilis cases in Caldwell County, to my knowledge. Unless something's just changed in the last week or so that I don't know about, but I don't know of anything.
Right, that's good.
I'll tell you, the best thing is early prenatal care. I cannot say that enough, because one of the tests that you get in your early prenatal care is a syphilis test. That is done on your history. And you again get a syphilis test when you're 28 weeks pregnant. You get another syphilis test at delivery. All of these tests are very important. If you test positive for syphilis at any time during your pregnancy, we need to know, we need to get you treated, and we need to make sure that everything is going to be okay with the baby too.
Right.
If a baby winds up with congenital syphilis, the baby can wind up with bone damage, teeth damage, and they can wind up with blindness and deafness. Also, stillbirths and miscarriages can occur from congenital syphilis. So it's extremely sad thing. I'll tell you, CDC guidelines recommend treating with penicillin, and it just varies on how much of the penicillin is used. It's called benathazine penicillin, and it is given IM, and usually it's given in the hip. And so depending on what they determine, how long you've had the syphilis, and whether or not it's a primary case or a secondary. With syphilis, there's different stages.
Right.
You can have what's called primary, secondary, and tertiary, and this comes along in different phases, and it causes different complications and problems with you. But if it goes untreated, it goes on into tertiary,
Right.
and eventually leads to death, or can. But if you have syphilis, it's going to be varied on what your circumstances are, whether this is a primary case or not, on how they're going to treat it.
Right.
And your doctor's going to have to tell you how they're going to treat your syphilis if you wind up testing positive. And of course, any sex partner would have to be notified, or should be notified. I believe this is North Carolina law, so it's a very serious thing. And they have a way to tell you anonymously, to tell your partner without you being involved if you're afraid for any reason or scared that consequences could happen to you.
Right.
It's called tellyourpartner.org. And I'll tell you, mothers should not be discharged from the hospital until the syphilis results are done. The baby should not be discharged. Should not. Because, well, especially the baby.
Right.
Because if it's positive, then we got to get right on to that and making sure that we're taking care of that baby.
Yes, definitely.
So we need to offer syphilis screening to all sexually active patients, especially ages 15 to 44 years old, in counties that have higher rates of syphilis. And I will tell you, in Caldwell County and our health department, we are definitely screening for syphilis in all our prenatal patients.
That's great.
I mean, that is definitely being done. And if they're still with us at 28 weeks, we are screening at 28 weeks as well.
Right. So really a pretty easy treatment for syphilis is just making sure you have the treatment
Right.
done if
Right.
you've tested positive.
Right.
That's
Yeah.
good.
I mean, it's not untreatable.
Yes.
But with babies, I mean, there's just so much things that can happen
Definitely.
with the babies.
Yes.
Yeah.
So Cindy, can you give us the contact information for the Women's Health Clinic, and what are the hours that you see patients, and what hours are you there at the health department?
Okay. We are there Monday through Friday from 8 to 5. Our contact number is 828-426-8488. We start seeing patients at 8 o'clock. We usually cut off around 3:30 to 4 because we're winding down and the health department closes at 5 o'clock. So, and it depends on what you're coming in for. It will depend on what the appointment times are. Pregnancy tests have certain times, and so do the histories as well. The histories take a little longer. They're an hour-and-a-half appointment, so we have to have more time for those. I believe our last history appointment's at 1:30.
Right. That makes sense.
Yeah.
So if you call that number, you'll get Isabel, and she's also an amazing
She is.
member of the women's health staff, and
Yeah.
she'll be happy to answer any questions for you also if you have any questions there. Thank you, Cindy, for being with us today.
Yes.
Thank
you're
you to
welcome.
everyone for joining us, and
You're
we
welcome.
appreciate learning about our women's health department.
I've enjoyed it. Thank you, Kristy.
Thank you.